Hi, and welcome to Restoration Chiropractic. My name is Dr. Taylor Sirois. I'm the owner and founder of Restoration. And odds are, if you're watching this movie, someone you know, a loved one, friend, family member, came into our office, was evaluated, maybe took some x-rays, but they're looking to make the next step, which is get adjusted in our practice. They want you to come along the journey with them, or maybe you have some questions about what to expect in our office. So I'm hoping that the next 10 to 15 minutes, I'm able to answer any questions about care in our office so that you know exactly what to expect when your friend or loved one is in our office so that we can help make their health their number one priority. We'll see you soon. Let's get started. Again, I'm Dr. Taylor Sirois. My goal here today is to just walk you through the ins and outs of restoration so you know exactly what to expect each time you or your loved one step into our office. So first off, I like to set up with some ground rules. Many people come into our office for typically one reason, and I would imagine you probably understand it's for pain. And that's okay. We want to get you guys feeling better and functioning well, but we really want to make sure that we're also keeping your overall health as the number one priority. What I mean by that is this. Last time you walked into your dentist and you got a cleaning, did they only tell you after that cleaning to brush your teeth when your teeth hurt? Odds are they did not. Odds are they said brush your teeth every day to be preventative. Well, just like the dental field, chiropractic care was meant to be preventative. Now, you don't get adjusted every day, but it's meant to be used actually when you feel good. Okay? Not many people know that. Most people wait till they can't lift their kids, their neck in so much pain they can't do their normal work or school, etc. They wait till the pain is interrupting their normal activities. Well, my goal is to educate you on the best time to use chiropractic care is actually when you feel well. To make sure that you don't wait till those things come on because it's typically going to cost you more time and more money in the long run. So that breaks us up into really two schools of thought when it comes to chiropractic care. There are those on the pain management side and the true correction. If you've been to our office, you can probably guess which one we are. We are one of the true correction phase, meaning I want to take your spine and how you're functioning and actually create some long-term stability, just like braces would. And then as you get that correction, we graduate to the retainer, which is you're periodically maintaining that change. Versus doing the pain management style, which is a few adjustments after a week, a month, whatever it may be. You may start to feel better, but it doesn't actually fix the underlying issue. And so what typically people in those offices will experience is they yo-yo, they start care, stop, start, stop, just based on how they feel in their symptoms. And they typically spend a lot more time and money at the chiropractor than if they would have fixed it in the very beginning. So I hope that makes sense to you. And so kind of going into that, just understand we're more of a neurologically based office, meaning we know that your brain is the master computer of your body and it communicates and sends every signal from the brain through the spinal cord to the rest of the body. So we want to make sure that every signal from top to bottom and back and forth is getting back and forth properly. So when I show you this model of the spine, you all know this, your brain sits at the base of your skull and the extension of the brain stem passes through to form that spinal cord. We have all these vertebrae that protect that area. And so when we do the postural x-rays and the neurological scans, all we're doing is finding, do you have any misalignments, we call those subluxations in our practice, that are compromising that area, putting pressure on the joint, pressure on the nerve, and causing aches, pains, and dysfunctions. And so one of the cool technologies that we get to utilize here at Restoration is thermography. So you or your loved one has already been scanned, and so what we do when the scan takes place, we run a thermography scanner from the lower part of your low back all the way up to the base of your skull. Along the way, it's going to show us, do you have any areas that are misaligned, putting pressure in your nerves? And if you do, it's going to show us at what level and how severe. Really cool. Gives us a very accurate baseline of how your body's functioning. Now, along the way, we're going to do new scans to show you how your body changes with the adjustments, but at least gives us a baseline to show how your body's functioning in that space and time. Now, once we find those, how we correct these is a little bit different than your quote traditional chiropractor. If you're someone who's been popped and twisted chiropractically speaking, just know I'm a third generation chiropractor. There's over 100 different techniques in chiropractic care, period. And I've had just about all of them done to me. I've been popped, twisted, jumped on, you name it. But the reason we don't really utilize those techniques is because, well, number one, they scare a lot of people, make them a little nervous. And number two, they're just not very specific. And what I mean by that is this, is if this segment is out of alignment, and I lay you down on flat on those tables, and when we do that popping, twisting motion, you'll realize you can realign that segment, but very rarely would you hear one little pop. Typically you hear a big crunch. It's because you're moving bones above and below at the same time that don't need to move. And so you're creating a lot of excessive motion. So if you're like me and you pop your knuckles with any amount of time, you can probably do that again in about 10 minutes. And it's because you've stretched out the muscles, the ligaments, and tendons, and so you've created hypermobility or instability. Same goes for your neck and back. If you're someone who can pop and twist their neck or their back, or you do it over and over again, or even get adjusted that way, over time, like popping your knuckles, you'll stretch out the muscles, ligaments, and tendons, and it will lead to really no stability at all. And the saying that once you go to chiropractor, you have to go the rest of your life actually stems from that, because you get so much instability. It may feel good for a day after you get adjusted, and the next day you wake up, you're like, I need to do it again, and again, and again, and again. So how we get around that is we use a technique that's called torque release technique, and the instrument's called the integrator. So this spring-loaded instrument right here is called the integrator. First chiropractic anything approved by the FDA, and it has more research behind it than any other technique. And what this instrument will do is it preloads. So there's a predetermined force already loaded here, but it slides up against one individual segment and will gently fire. It will push one segment back at a time, taking tension and pressure off the joint, but taking pressure off the nerve so that we can restore that communication from the brain to the body. So again, you're feeling well and you're functioning at your best. The cool part about this instrument is that when it fires with the same force, the same velocity, at the same amplitude every single time. So it's 100% reproducible. We do, myself, I'm one of the adjusting docs in our practice. We have a few others, but it doesn't matter who will adjust you because the neurological checks that we use to assess your spine are all consistent, and we all use the same instruments. So everything is going to be consistent along the way, which is very important for you to track your progress. Now, the other cool part about this instrument, it does a linear force to go forward and backward, but it can also torque left and right, which is why it's called torque release technique. So if you're someone whose spine sways or rotates, or maybe you have some wedging or rotation I'm going to show you in a second, this instrument can actually torque left and actually can close the rotation and close the wedging. And it allows us to get three-dimensional changes, which is really, really important. So just as we get into what spinal x-ray should look like, I want to show you what a normal spine as an adult would look like. So from front to back, ideally when we're looking at a spine, the hips should be level from left to right. The spine should be straight up and down from front to back. From the side though, you should have three distinctive curves. The neck curve, the middle back curve, and the low back curve. And in between, you're going to have these nice open disc spaces, so as you're walking, talking, jogging, all the forces evenly being transmitted through your spine, and life is good. What happens? We all have slips, falls, injuries that might occur along the way. A lot of people have to sit all day long for their work or maybe for school, and sitting is now dubbed kind of the new smoking. So even sitting with improper posture or form for any length of time can cause some detrimental changes. And what I mean by that is this. Just say, for instance, you sit at an office desk or you're sitting in class and you just cross your legs for 15, 20 minutes, but you do it every day. Over time, it's enough to cause some imbalance where your hips are going to start to shift and tilt. No trauma. Okay, no big sport injury, but just sitting all day long. And if that is left that way for any length of time, your body will continue to compensate. So a lot of times we'll see if hips tilt one way, and then the lumbar spine starts to curve the other. This is extremely common. We can see this. Okay. What this also does is when you think about this, anytime you walk, run, jog, whatever you're doing, now you're putting uneven force to the hips, knees, and ankles, and that can cause them to wear out prematurely as well. So that's how we're going to address those issues along the way as well too. Now here in your middle back, we should all have a nice thoracic curvature. There's a lot of times we take x-rays in this practice and people have lost that curve. They're completely straight up and down. Called straight spine, military spine, whatever you want to call it, but this will lead to premature wear and tear arthritis. A lot of our military men and women with heavy packs and manual labor they do. If you have a manual labor job, football, rugby, these are really, really common things. And we want to make sure we readjust these because just like the tires on your car, if your tires on your car are out of alignment, what happens? Well, the tread starts wearing out unevenly, they can have a blowout on the highway, whatever, but it leads to a premature wear and tear. One of the goals of what we're trying to do here is by balancing out your spine, we're reducing that wear and tear on these discs. Because a tire in your car is a couple $100, you can go replace it. A disc between your spine is priceless. They do not make new ones of these. Okay? It's spinal surgery, fusions, and it's not a fun place to be, so we want to avoid that at all costs. Here in the middle back, again, a few people have never maybe even heard of this word, but scoliosis is a very common thing we find in our practice, and that's when these curves sort of deviate from left to right. And this typically happens when you're going through your growth spurts as a kiddo. So a lot of people ask, why would my baby or kid need to get adjusted? Why would my college student need to get adjusted, etc.? And it's because these curvatures start out very early on, and if we can find them and identify them early, you can start to get change. I equal have amount of people that are like 40 and 50 that when we take their x-rays for the very first time, they had no idea this was going on. They knew something felt weird. No one ever told them they had scoliosis. And at that point, we can only stabilize. We can't really correct much. So early detection leads to earlier prevention. That's why we see so many kids in their practice. Now, the other big thing I want to show you guys is this. This is what a side picture of the neck right through here should look like. This is a 35 to 40 degree curve, which would be pretty normal. And on average, if you lose this curvature, and say you just have like a straight spine, just like this, that typically takes about 20 years. And that's not a 20-year-old, that's a 55 or 60-year-old after 20 years of wear and tear and arthritis, okay? If you have a reverse curve, that's about 25 years plus. And a lot of people think, well, this must be someone that's really old, 80, 90, whatever. And I'll tell you what, some of the worst curves I see in this practice, they're not 80, 90-year-olds, they're 8, 9, and 10-year-olds. Because these curvatures, like I said, take that long. We have a lot of things in our world today that fast track that. Cell phones, computers, tablets, everything is down, down, down. The average American's on their phone 2-3 hours a day, just like this. And so we have to start correcting these things, okay? Because if we don't, this leads to earlier and earlier wear and tear. And I have 20-year-olds that come into our office with already signs of arthritis in their spines, and that should not be possible, period. So in our office, when we see these things, it's not all doom and gloom. Our goal is to stabilize and correct this, keep it from getting worse, and then to start leading, guiding these curvatures back in the right direction. It is possible, it just takes time. It's like getting braces on your teeth. It'd be great if you could do it for like a week and then take your braces off, but we all know you have to wear braces for an extended period of time. And once you get the correction, you wear your retainer, and then you have that correction for hopefully the rest of your life. That's what we're looking for in this office. True correction with long-term results, period. So as I close from the spine, there's two things I just really want to hit on. This neurological chart behind me really goes through all the neurological systems that we address in our office, and it's just the principle is this. There are over 78 trillion nerves in your body, only 8% are pain fibers. Everything else is telling your body how to function, okay? Telling your heart to beat, lungs to breathe, food to digest. And so when we adjust up the neck, or the middle back, or the low back, we expect those other organ systems to be affected. So like here in the neck, one of the most common reasons people come to our office is for headaches and migraines, okay? People on a lot of medications, doing Botox injections, all kinds of crazy things, but they're only treating the symptoms, they're not getting to the root cause. We see people get off medications, start having days without headaches and migraines, days that they're sleeping better, days that their focus is not blurred from all the migraines and all the tension. And so my goal, guys, is just to really tell you this. There is hope, and drugs, medications, and surgeries should not be a first resort, it should be a last resort. Okay? We take care of a lot of primary care physicians and nurses in our practice, so they all agree it should be a last resort, not a first move. Okay? I know many people that are going to watch this video have already tried those things, and so my goal for you is to say, we're going to try a better way. We know that when we realign the spine so the body can communicate properly, your body wants to heal from the inside out. Period. We were not created to get sick all the time, take a bunch of drugs, a bunch of medications, surgeries, and die on the way death. We were created to heal from the inside out. Okay? But your body has to be able to communicate properly. I can give you stories about people getting off inhalers, getting off CPAP machines, people getting off medications for bowel issues, etc. Because I'll be honest, most of our patients hold stress in different areas. A lot of our gals carry stress in neck, shoulders, jaw, so everything's really tight here, and that has all those effects. A lot of guys carry low backs. So diverticulitis, Crohn's, irritable bowel syndrome, whether it's bladder and kidney issues, reproductive organs, guys, we have stories for all these things. And so if you have questions, please ask myself or one of our team members, because we just want you to have the best outcomes possible, and we want to help you make healthier choices to make your health your number one priority. And so in a second, we're going to go over recommendations with maybe you or your loved one. And just so you know, recommendations in our office are based off 4 criteria. We want to make sure we give you the most amount of change in the shortest amount of time, but we realize that no one gets the way they do overnight. Okay? When you see your x-rays, they're going to tell a story. And so the goal being this is, if I had one superpower, it'd be to be able to take you from being out of alignment, and if I could do one adjustment and put you back in a proper position after one adjustment, that would be my superpower, because again, I'd be very rich and very famous. Okay? But the honest truth is this, is if you're out of alignment and I put you back in, tonight, tomorrow, the next day, whatever it may be, the muscle memory, it's going to want to slowly pull you right back out. So we got to get over that. Okay? We got to start seeing you maybe a little bit more frequently. So some people I might recommend to see once a week, twice a week, even 3 times a week in the very beginning, just so you start holding your adjustments longer and longer, with the end goal, I assure you, of seeing you less and less. Okay? But it's like going to the gym. It'd be great if you get a 6-pack after one workout. Everyone would have a 6-pack, but it doesn't work like that. You really have to work on building balance and correction to see those results, and we will do that here. The other thing people ask is like, so that sounds great. I'm all in, I want to get chiropractic care for myself, family, whoever it is, but what's it going to cost? And I love just addressing this really broadly, really fast. The average cost for a chiropractic adjustment here in the Columbia area, just so you know, it's around $55 to $65 an adjustment. Okay? If you have insurance, we'll go over that with you, but if you don't, which the majority of our patients don't, that is the average you're stuck with. And so our office, just so you know, if we give you guys corrective care recommendations at that cost, it would easily cost one person $3,000 or $4,000. You add a couple to that, it's like 8 or 9. You had a family, it's like 10 grand plus to get chiropractic care. Okay, and it's not feasible for people. It's ridiculous in my mind. So what we do in our practice is this: we take the average costs, we legally discount our fees 50 to 60% below the averages. So I think for most people, not for everybody, but allows me to give you a recommendation so you build true correction once and for all, and then you periodically maintain it. Okay, we want to be accessible to all people. I have people that bring whole families in, people that are single, whatever, all types of demographics, and people that have a lot of money, people that don't have a lot of money. That's fine. We want to be the chiropractor for all people, okay? Because we know that everyone deserves to have a spine that is free of subluxations and that their body is able to fully participate and be at its full potential all the time. So what we've done, again, we discount the care, we put you on a recommendation, and we're going to track your progress along the way. So if all that sounds good to you, we're going to go over those recommendations. We'll get you adjusted, but please, along the way, just know we are great chiropractors. We are terrible mind readers. So if you have questions, concerns, please ask them along the way with us, because we want to be part of your health journey, and we look forward to serving you.